Alrighty, let's get started. My name is Kelsey Parker. I am a program coordinator with Substance Use Prevention and Treatment, and I oversee our perinatal program, Options for Recovery. We are honored right now to have Dr. Chasnoff present Addressing Misinformation about Drug and Alcohol Use During Pregnancy. And you can take it away, Dr. Chasnoff.
Okay, good afternoon. I've been looking forward to this session because I think we can have a lot of fun with it. To that end, as we go through, if you have questions or comments, please put them in the chat box. And every bit of time, I will stop and ask Kelsey if any questions or comments have come in. In addition, at the end, we're going to ask you to unmute if you have comments or questions or would like to contribute to the conversation in any way. I'm looking for the kind of misinformation and myths that you've heard out through your work, because some of the can blow your mind, some of the things we hear. I would ask you all to please be sure you're muted so it doesn't distract from our conversation. So as I thought about this, about the misinformation is out there, I started thinking about the history of myths and misinformation about pregnancy. And there's a world of them. I remember my grandmother and most certainly my mother-in-law had a whole wealth of misinformation about pregnancy that they carried around with them and communicated. But I guess the longest standing misinformation is all about the stork delivering babies. Now, can you imagine back in the day when people talked about the stork delivering babies, if there were social media then, and how that would have gotten out on social media? So we have a struggle, a real challenge in front of us, because as clinicians, as administrators, as program managers, we're faced with the misinformation that is spreading so rapidly on social media. So today, this is going to be the first in a series that we call Mythbusters, addressing misinformation about drug and alcohol use during pregnancy. So that's our very specific target. Now, I started coming up with the misinformation that's out there. Where did I get this? Everything I'm going to show you either came in through the Healthy Beginnings website here in Sacramento County, or other websites that we manage and that we work with other states and communities, and the kinds of questions and statements that I just get by email all the time that come into me. So everything I'm going to show you is true to life. Somebody actually said this or asked this. And these are the kinds of things we need to be prepared to respond to. And the way we respond to misinformation is through science. And so I'm going to try to give you the scientific basis of how we can correct the misinformation. Now, the first, this came into the Healthy Beginnings, Sacramento Healthy Beginnings website, direct quote, "Avoiding sugar and high processed carbs during pregnancy matters just as much, if not more, than avoiding alcohol." Well, that statement is false. Of course, we don't want pregnant women, anybody, taking in large amounts of sugar and carbs. But as far as the danger to the developing fetus and to the child long term, there is extensive scientific information that shows that outcomes of pregnancy, outcomes of children are multifactorial. And as we look at any one pregnancy, we have to consider genetics. What are the genetics that the woman is carrying with her? For example, we've published twin studies, twins and triplets, whose mothers drank alcohol during pregnancy. And one of the twins has full-blown fetal alcohol syndrome with intellectual disabilities, and the other twin is perfectly normal. And that's because the twin who with the fetal alcohol syndrome was genetically more vulnerable to the effects of the alcohol. Now, that's why we can't turn to any one woman and say, here's how much alcohol you can drink during pregnancy, because we don't know the genetic vulnerability. Now, of course, the twin studies I'm talking about are all of fraternal twins, not identical. If the twins are identical, then they do have the same outcomes related to the prenatal alcohol exposure. So genetics is something that, what the woman is bringing forward with her, and the father contributes to genetics also. We have no control over and no understanding of at this point. The second is the personal life factors. Is she getting good prenatal care? Does the woman have other risks, such as she has diabetes during pregnancy? Is she taking other drugs? So there are multiple personal life factors. And then there's the environment. The environment it would consist of, is there domestic violence? Is she living in poverty? Does she not have access to care? So there are these huge environmental issues. Now, we can't do anything about something like poverty. That's way beyond the scope of our work, and nobody has found a cure for poverty yet. But what research has shown is when you have multiple risk factors, if you can manage the risk factors, you can improve outcome. And the research that's been done, example for children, think about juggling one ball. If I gave you one ball, you could juggle it successfully. If I gave you two balls, with some practice, you could juggle two balls. But if I gave you three balls to juggle, it's highly unlikely you're going to be able to juggle those three balls without lots of practice and lots of instruction, lots of support. Well, research in child development has shown the same thing. If a child has one risk factor or two risk factors, they can still do pretty well. It's when a child has multiple risk factors, three or more, that become an issue. So if you have a child living in a home, he was prenatal drug exposed, his parents are suffering with domestic violence, there's domestic violence in the family, and there's poverty. We can't do anything about the poverty, but we can certainly, if necessary, remove that child from the home with domestic violence. And there are interventions we can use to address the prenatal substance exposure effects. And so that's our job. We're not going to cure all aspects, but we can certainly advise a woman not to eat lots of sugar and carbs during pregnancy. But if that's the only thing we're addressing, it's not going to provide much help. So what the research has shown is when you control for all those other factors that we were just talking about, use of alcohol in pregnancy is associated with this long list of difficulties: high rates of prematurity, low birth weight, a baby being born stillbirth, NICU admissions, maternal death, newborn death, long-term behavior and learning deficits, and in fact, fetal alcohol syndrome is the most common preventable cause of intellectual disabilities in the world. So we know that children whose mothers are using alcohol are at extremely high risk for long-term deficits. Another thing that we hear, and this came in through one of our websites, the use of some drugs during pregnancy is worse than the use of others. And this myth really, when we talk about it, it depends on what you mean by, quote, worse. And probably the biggest challenge we have is addressing this and the misinformation that's brought forward by the federal government. Because what the federal government tends to do is they'll go through a period, and I'm sure many, if you're old enough, many of you remember the days of the babies being exposed to cocaine. So the federal government said, okay, we're going to put all this money into taking care of children with prenatal cocaine exposure. And then more recently, the big issue was methamphetamine. And so the federal government tends to take on one drug at a time. And with the opiate epidemic, right now you'll see there's lots of money out there. They're funding lots of programs to address opiate use during pregnancy. But the reality is the most common form of substance abuse during pregnancy is polydrug use. So pregnant women are using multiple substances. And those multiple substances almost always include tobacco and alcohol. And so it's very difficult to say one drug is worse than the others because they all have an effect. And when it comes down to the drug that is most commonly ignored is nicotine. This statement came in. Nicotine in pregnancy isn't bad because nicotine patches or nicotine gum can be recommended to pregnant smokers. False. Nicotine patches and nicotine gum can be recommended to pregnant smokers, but the reason that they are is that at least you're controlling for just the nicotine exposure. When an individual smokes cigarettes, they're getting multiple other toxic elements, toxic chemicals that are in the cigarette smoke. And so at least with nicotine patches, you can try to control the dosage and the frequency of use and the purity. You're just getting nicotine. However, nicotine is highly toxic. And so to address this, I want to talk about, now, if some of you have been in my trainings previously, this is something we've talked about, but it's really important. So we're going to talk about it again. We have to understand the biological effects of various drugs. In order to understand why no drug is, quote, worse than other drugs, we need to understand how they all act on the catecholamine system. Now, what do I mean by that? The way your nervous system is built, if I want my fingers to wiggle, I send an electrical stimulus from my brain to my fingers. Now, there's not one long nerve that carries that electrical stimulus to my fingers, but it's a series of nerves. And as the electrical stimulus passes down the nerve pathway, when it gets to a nerve gap, that electrical stimulus must cross the nerve gap. And the way it does that is through the catecholamine system. Now, all of you have heard of the catecholamines. There's dopamine, serotonin, norepinephrine. The one we're going to talk about is dopamine. So here's what happens. The electrical stimulus carries down the pathway. The dopamine picks it up, carries the electrical stimulus across the nerve gap. And that's why the catecholamines, dopamine, for example, are also known as neurotransmitters. Neuro meaning nerve, transmit, carry. So the neurotransmitter, the dopamine, carries the electrical stimulus across the gap and then circulates back. And this is called reuptake. So the dopamine picks up the electrical stimulus, carries it across, releases it, and then the dopamine is taken back up. It's this reuptake process back into the first nerve ending. And that's why you never run out of dopamine, is because of this reuptake process. So when I want my fingers to stop wiggling, what my nervous system is doing is taking back up the dopamine. And so they stop wiggling. That's why dopamine is known as the regulatory center of the brain. It regulates our motor responses, emotional responses to various stimuli. So dopamine is the regulatory center of the brain. Now, unfortunately, dopamine is also the pleasure center of the brain. And so when we eat food, our dopamine levels go up about 125%. That's why we like to eat, is because it stimulates dopamine, makes us feel good. If you smoke a cigarette, nicotine increases dopamine release 200%. Cocaine, opiates, marijuana increase dopamine release by 300%. And methamphetamine raises dopamine levels by 1,000%. So that's why people use drugs, is to get that surge, to get that high from that excess dopamine. Now, all the drugs, including nicotine, act this way, though through different methods. For example, methamphetamine just causes massive release of dopamine across the nerve ending. Cocaine, there's a normal amount of dopamine that crosses the nerve gap, but then cocaine blocks dopamine reuptake. And so you get excess dopamine down here at the distal nerve ending. Opiates, a little more indirect, but what opiates do is when you have an opiate, such as represented here by morphine, morphine will block opiate receptors. The role of opiate receptors is to release GABA, gamma aminobutyric acid. We'll just say GABA. What GABA does then is inhibits dopamine release. So that's how you control how much dopamine is out there, is through this release of dopamine through the neuroreceptor system. However, when you use morphine or any other opiate, it blocks the opiate receptors. So the opiate receptors cannot release the GABA, which then tells the dopamine terminal to release more dopamine. So it's a little more circuitous than cocaine and methamphetamine, but it's still the same thing. Endpoint is you get higher dopamine levels. And with nicotine, it's the same way, excess dopamine release. So whatever drug you can name, the way they act, the way they give you this high, this effect on your brain, is through this dopamine receptor system. Now, dopamine, because these drugs have excess dopamine release, now dopamine can act on smooth muscle. That's the other target of dopamine. And the uterus is all smooth muscle. And so one of the things that happens is you get uterine contractions. And if you've worked with pregnant women with histories of substance abuse, they'll tell you that when they use cocaine or meth or opiates, even tobacco, I had one woman tell me, it feels like a ball cramping up in my stomach. But that's what's happening, is you get contractions of the uterus, which is why there are such high rates of prematurity, low birth weight. And when we do studies, now coming back to this question, what is the worst drug? When we do studies, what we find, looking at bad outcomes such as low birth weight, tobacco statistically has a 3 times greater impact on producing low birth weight than does cocaine. So there's no way you can say one drug is worse than the other, because their final pathway is all through the dopamine receptor system. You also get high rates of failure to thrive in the infants, high rates of crib death. And in fact, again, when you do the studies of substance-exposed infants, The one drug that produces the highest risk for crib death is tobacco. And even secondhand smoke from tobacco increases rates of crib death. You can also get direct effects on the brain, on the developing fetal brain. And I've shown you in previous programs that we've had, I've shown you the babies who had strokes in utero from their mother's cocaine or methamphetamine use. But more importantly and more commonly is the effect on the way that the babies are able, once they're born, the children are able to think and process information. So we're going to talk about this for a minute, but I'd like to stop here just for a second. Kelsey, have any questions come in, comments?
No one has raised their hands and no one has dropped a question in the chat box.
Okay.
If you guys would like to ask a question, you are able to remove yourself from mute at this time. Okay.
Okay. Now, we've been doing this distance learning for 3 years now, but as a presenter, I can't see how you're reacting. And I don't know if this is all making sense to you, it's going over your head, or you're bored out of your mind. So the only way I know that you're with me is if you ask questions or make comments. So please use the chat box. Send us in any information, any questions you may have. So what's the effect of these various substances we've been talking about on the way the children are able to think and process information long term? So what is information processing? Information processing is the way you bring information into your brain and use it. There are 4 steps. Input, how information comes in. Integration, how you organize the information. Memory, how you store the information to use whenever you need it. And then finally, output, how you use the information to respond appropriate through motor behavior, language, etc. The way it works in the brain, well, these are the parts of the brain. I'm sure most of you are familiar with this. This is the frontal lobe, parietal lobe, occipital lobe, temporal lobe. And a very important part of the brain is the prefrontal cortex. Why is the prefrontal cortex so important? Because that's where dopamine is located. So the prefrontal cortex is actually the real regulatory center of the brain, moderated through dopamine. So how does information processing work? You bring information into your brain from different pathways. Anything you see enters the eye, travels along the optic nerve, and inserts on the back of the brain, the occipital lobe. Anything you hear enters the ear and inserts on the midline of the brain, and taste, touch, and smell enter the parietal lobe. So you have information entering through different pathways, and what the brain has to do is integrate that information, that is, bring it all together so it makes sense. Then you store it in memory, and when you need the information, it shoots forward to the prefrontal cortex and tells you how to respond. Now, let me just give you an example. Let's say you're walking along the sidewalk and you come to a street. What do? You look to see if a car is coming. So let's say you see the car out here. The image of the car enters the eye, travels along the optic nerve, hits the occipital lobe. It's called the visual cortex. Flash, there's the car. That image of the car shoots forward to the prefrontal cortex, where dopamine fires off and says, stop walking. That's called motor regulation. So that's why we look at children's behaviors from the regulatory perspective, because you spend all day regulating your behavior as adults. Now, in fact, right now, you're in this session. Hopefully you're watching the screen, you're listening, and your dopamine is firing off, helping you focus. That's how you maintain attention. Now, why are we discussing this here? Because you remember, I just got through telling you, dopamine picks up the electrical stimulus, carries it across, releases it, and then there's reuptake. However, what I didn't mention before is over time, you begin to deplete your dopamine receptors because methamphetamine, for example, is causing massive release of dopamine. Cocaine, you have normal dopamine release, but it's getting blocked from reuptake. Opiates, nicotine, any drug you can name, you're going to get depletion of the dopamine receptors. Now, what do you think that's going to do to someone's behavior if their dopamine is depleted? This is a PET scan. Now, PET scans, what we do with PET scans, you inject dye into the patient, and then dopamine picks up that dye. This is a 22-year-old young man. We're looking down on his brain, and the yellow and red is dopamine. Now, this young man went out and started using cocaine. This is his PET scan 1 year later. And what you can see is the yellow and red are missing. I have hundreds of these kinds of studies with nicotine, every drug, marijuana, every drug you can name. Here are the pre-drug use, and here's what it looks like after they've been on drugs. All of these represent for about a year. All of the drugs of abuse act in the same way. They deplete the dopamine receptors over time. So that's why, going back to our original statement, is one drug worse than the other? This is why you can't say one drug is worse than the other, because they all have effects and they all affect the dopamine receptor system. Now, in adults, about 14 to 24 months of being drug-free, you begin to see the dopamine system starting to repair. And you start seeing dopamine reappearing on the PET scan. But it takes about anywhere from 14 to 24 months. Now, with children prenatally exposed, they're born with depleted dopamine receptors that don't recover. And of course, that's a whole other topic. So let me just check. Any questions about any of this?
Yes, we do, Dr. Chasnoff. Number one, when you are talking about the dopamine, is this also what we would refer to as the reward center pathway?
Yes. Dopamine is not only the regulatory center of the brain, it's the pleasure center. And that's how we get into trouble, because it's pleasurable taking drugs. These drugs trigger, your pleasure response through the dopamine. So the answer is yes.
The second question is, how many doctors do you run into that are still advising women to drink small amounts of alcohol?
Lots, including in your county. I won't say any more than that. That is one of the myths that is out there, that a little bit of alcohol is okay. The research shows that's just not true.
Shannon actually asked a really great question. She says, what about methadone while pregnant? How do you feel about this?
Well, methadone, I think I have I don't remember if I'm doing it this time or next time, about methadone and buprenorphine during pregnancy. Methadone is the gold standard for medication-assisted treatment. It has all sorts of advantages. And as I recall, I'm going to talk a lot about methadone on the next webinar that we do when we're addressing myths. So yes, so methadone, we'll give it a thumbs up. We'll talk much more about it at a future date.
Next question. If someone doesn't know they are pregnant and they are using drugs or smoking cigarettes, etc., but then say they find out at 5 or 6 weeks they are pregnant and they stop using everything, including nicotine, is it too late? Is the damage already done?
It is never too late, but we're going to address that question a few slides from now. So that is a very good question, and we'll talk lots more about it in a moment.
Okay. Next question. How does MDMA affect the birth weight and development of the baby? Is the dopamine release of MDMA comparable to methamphetamine?
That is a great question. And you caught me because I should have said every drug except MDMA acts on the dopamine system. MDMA works on the serotonin system. Serotonin is another of the catecholamines, neurotransmitters. So it does not have that much impact on the dopamine system. It's more the serotonin system.
As drug testing coordinator here now, 90% of the drug tests we do, MDMA is a part of methamphetamines now.
Really? Oh, it's combined with the methamphetamines.
Yes, sir.
Yeah. You talk to folks, they will tell you that they do that. They combine it so that they can control, so that what happens with methamphetamine is you get this powerful 1,000% increase in dopamine levels. And it's so powerful and so fast, you get high rates of cardiac and, the heart attacks, the strokes. It's very easy to overdose. So MDMA, some drug dealers started putting the MDMA in the methamphetamine so they weren't killing off their clients, their customers. So it doesn't surprise me that you're finding MDMA. Yeah. But it acts on it does not act on the dopamine system. It acts on serotonin, and serotonin kind of soothes you. Has a calming effect. So not surprising to hear that.
Next question. What about the effects of the newborn while nursing and using substance? That's another one that we're going to address next time. It's very complicated, and I have slides that I'll be using. So that's to say, number one, we want women to breastfeed. Number two, if they're using any of these substances, they cannot breastfeed. All of these substances cross into the breast milk, and they have varying lengths of time. Now, if you're interested in this, we did a webinar on breastfeeding and substance use already. And I think Michelle or Kelsey can tell you how to get that recording. Yes.
And so we have a full webinar on breastfeeding, and I'm going to touch on it next time. That was a whole hour and a half discussion of breastfeeding. So I just don't have time to really get into that today.
Yes. Next question is, what about marijuana, and does a pregnant woman have extra dopamine?
Okay, we're going to talk about marijuana.
Okay.
You're asking great questions, exactly the kind of questions that I was expecting. So I have slides for that.
What about, does a pregnant woman have extra dopamine?
Just because of pregnancy?
Yeah, would anyone like to, Stephanie, would you like to take yourself off mute to clarify?
No, I just thought maybe like because of hormones and stuff, maybe you have like a higher level of dopamine.
No.
Now,
the stress, if the woman is stressed with the pregnancy, yes, stress will raise dopamine levels.
Next question, how far back do the tobacco studies go? I wonder because my parents' generations were very heavy smokers and had quite a few post-war babies. Any studies done with those births?
Yeah, I'm one of those too. My mother used to try to figure out what kind of work I was doing. I left my general pediatrics practice to focus on this, and she would say, "Well, hey, look at you, you're fine, you know." And I smoked cigarettes all through pregnancy, and my response was always, "But think how much smarter I could have been." There were no studies being done at that time, and so was there an effect? Most likely. I'm a little ADD myself, but with good parenting and good teachers, those of us who are adults now, we learned how to manage our mild, quote, ADD. It's not truly ADD, but, you know, we can call it compartmentalization. But yes, there definitely are effects from the tobacco. In fact, studies have shown the most common known cause of attention deficit hyperactivity disorder, besides genetics, the most common cause is cigarette smoking during pregnancy. So there definitely is an effect. It just wasn't recognized. Nor was alcohol use during pregnancy recognized until 1972. So.
And last question, can you tell us the details of what the dopamine does during alcohol use, extra production, or blocks reuptake, etc.?
Alcohol, you'll notice I have been saying drugs. I have not mentioned alcohol because alcohol affects a different part of the brain. And I think I have we're going to talk about that for a little bit. But it doesn't have a whole lot of effect on the dopamine system as much as on the part of the brain known as the limbic system.
That was the last question. So thank you.
Okay, good. I like all those questions. Okay, the next myth. Addictions treatment is a waste of money. It doesn't work. I know all of you have heard that. And that statement obviously is false. And one of my favorite studies is one that looked at treatment outcomes for people with high blood pressure, people with diabetes, and people who were in addictions treatment. And what that study showed was that successful treatment, however you defined it, taking your medication, controlling your blood pressure, using your insulin appropriately, controlling your diabetes, following up on addictions treatment, becoming drug-free, the outcomes were exactly the same. The rate of success for treating high blood pressure, diabetes, and addictions is the same. It's just that there is this bias about addictions being a moral failing, rather than looking at it from a medical perspective. Oh, whoever was asking about marijuana earlier. Some mothers have comorbidities. Some may choose to use weed instead of heavy medications, so the marijuana is a safer option for them. False. Okay, so let's talk a little bit. And we did do a full hour-and-a-half webinar on marijuana use in pregnancy. It was recorded, and Kelsey or Michelle can get you access to it. Let's start very simply. There was a study of close to 25,000 live births. And what these researchers did is that it did a full substance use assessment at the women's first prenatal visit. Average age was 28 years. Now, when they talked to the women, 26% had ever used marijuana, ever, which means about 74% had never used marijuana. 9.5% were regular users prior to pregnancy, and 2.6% continued to use during pregnancy. And so the researchers looked at pregnancy outcome. The women who never used marijuana the women who had ever used marijuana, the women who were using before they knew they were pregnant, and then the ones who used throughout pregnancy. So those are your groups. And of course, we talked earlier about genetics, about the environment, et cetera. They controlled statistically for socioeconomics, demographics, whether they were smoking tobacco or using alcohol in addition to the marijuana, and whether they were using any other drugs in addition to the marijuana. So what they were trying to do is focus down on the effects of marijuana. And for those women who were using marijuana during the pregnancy, through the pregnancy, versus were not using any marijuana during pregnancy, even if they had used prior to conception, but had stopped. Women who used marijuana had babies with higher rates of low birth weight, birth length, and gestational age. So there's a higher rate of prematurity and low birth weight babies. And if a baby is premature and low birth weight, he's 30 times more likely to die in the first year of life. They're more likely to be small for gestation age and more likely to be admitted to the neonatal ICU. So this was a study done about 10 years ago. One of the largest, first and largest large studies of marijuana use in pregnancy. Now, some of you are probably thinking, well, come on, how do you know it wasn't other factors? To really do a pure study, you'd have to take a big group of pregnant women and randomly tell them, half of them, you use marijuana during pregnancy, and tell the other half, don't use marijuana. That's the only way to do it. Obviously, you can't do that. And so we turn to animal studies, and the animal studies tell us the exact same thing. Now, what I have here is a list of some of the basic effects. This is decreased fetal growth, low birth weight, et cetera. And these are all the studies that have shown the effects on fetal growth, including animal studies. And the other, a relatively new study that came out relatively recently, is that if women use marijuana during pregnancy, there's a 2.3 times increased rate of stillbirth. So more than twice the rate of stillbirth in pregnancies complicated by marijuana use. So there are good data out there now that tell us marijuana is not a safe drug to use.
Sorry, go ahead, Dr. Chasnoff.
Go ahead. No, if there's a question, go ahead.
Can we get the video for staff? I already dropped the link in the chat box. And then John would like to know, are those numbers self-report women using marijuana during pregnancy?
Those numbers are self-report. Now, there are very recent studies that also use toxicology, urine toxicologies, et cetera, and all the studies come out the same. Long-term, any other questions?
No, that is it, Dr. Chasnoff.
Okay. Long-term outcome, there are multiple studies that show deficits for children as they get older. And if you look at this list, you'll see deficits in behavioral functioning and impaired cognitive and neurocognitive skills. Those are mostly when it starts getting down to the really good studies. Most of these are related to regulatory behaviors. And some of the largest studies long-term, and these were done in Canada, where the rate of polydrug use is much, much lower than in the United States. What it was shown is when you control for all other factors, studies have shown that 14-year-olds whose mothers use marijuana during pregnancy have significant difficulties with executive functioning the ability to regulate your thinking, to plan and complete a task, to think through cause and effect. And if you've been on our other earlier webinars, you will you remember that we talked quite extensively about it. I think one of the most interesting studies is a group of 18 to 22-year-olds who had never used marijuana themselves, but had been followed long-term because their mothers had used marijuana. And they did functional MRIs in that study. A functional MRI is when you do an MRI, but you give the person a task. So while they're doing this task, whether it's a math problem or whatever, you can watch the brain working. And what they showed on these functional MRIs was prenatal marijuana exposure altered neural functioning, mostly affecting short-term memory over the long term. So when it comes down to it, marijuana is not safe to use during pregnancy. Any questions about marijuana come in?
Yes. Kelly
This is
wants.
usually when people get all riled up. Yes.
Yes. Kelly wants to know, is there a difference when the marijuana is ingested? So Kelly, are you talking about like edibles?
Yeah. There is a difference because THC is absorbed, which is the active ingredient in marijuana. It's absorbed very poorly through the GI tract. And so, yes, you are getting some marijuana, but the dose, THC rather, but the dose is much lower than if you smoke it. Anything else?
No other questions.
Okay. So the next myth, and of course, I know all of you have heard this. Oh, it's okay. I'll stop using as soon as I find out I'm pregnant. My response to that is yikes. Why? Here's what you need to understand. Alcohol, marijuana, any substance a person takes to alter how they feel has to be able to cross over from the blood to the brain. And it's called the blood-brain barrier. To do that, it must be highly lipid soluble. That means it's absorbed into fat because the brain is all fat. And it has to be of low molecular weight, meaning it's actually a very small particle. Any substances that change the way you feel or think are lipid soluble and of very low molecular weight. So any substance will cross over. And that means not only will it cross to the brain, it crosses the placenta very readily. So early in pregnancy, if someone's using, and this gets to the question of, if they don't know they're pregnant, it will cross the placenta. Now, let's talk about early pregnancy. There is a period of pregnancy called the pre-neuronal phase. And it's from during that phase, between 16 and 22 days after conception, there's something very important happening. It's called the neural tube. Now, what is the neural tube? The neural tube is literally a tube that is one of the first things to form in the embryo after conception. And the neural tube is the very basis of the development of the brain and spinal cord. Between 16 and 22 days after conception is when the neural tube closes. It appears if a woman is drinking alcohol between 16 and 22 days after conception, you can get agenesis of the corpus callosum. Now, the corpus callosum is at the very center of the brain, and the corpus callosum is what transmits information from one side of the brain to the other. Okay? So let's just take an example. let's say it's a beautiful day and you're out for a nice Sunday drive and you're driving along the freeway and all of a sudden somebody comes roaring up behind you, almost hits you in the back, tailgates you, almost hits you in the back of the car, and then zooms around you and cuts you off. What's your response? You son of a gun. You have this emotional response. You're angry. But do you do anything about it? No, because the emotion is on the right side of the brain. The right side of the brain is the emotional side of the brain. So you're thinking, you son of a gun. But then the information crosses very rapidly across the corpus callosum to the left side of the brain, which is the rational side of the brain. And you calm down and you think, okay, go right ahead. I'm not going to tailgate you. I'm not going to chase you. And then you go on and you have a nice Sunday drive. If you were exposed to alcohol prenatally and you have difficulty, there's damage to the corpus callosum, and you have difficulty moving information from one side of the brain to the other, affecting your corpus callosum, you're not going to be able to calm down. And one of the things, if any of you work with children with prenatal alcohol exposure, one of the common complaints is the rages they have. The least thing just sets them off. And that's because of damage to the corpus callosum. You can actually get agenesis of the corpus callosum. Genesis in the Bible means beginning. Agenesis means without beginning. Now, this is an MRI. We're looking across the brain. This is a normal MRI. And here are the different parts that we've talked about before. But look at the corpus callosum. See how it runs front to back. It's right in the midline of the brain. Down here at the left, this is a child born with no corpus callosum. This is what it looks like. This child's mother was a heavy alcohol user, but she happened to binge between 16 and 22 days after conception. There's a large study out of San Diego at UCSD that estimates the most common cause of agenesis of the corpus callosum is alcohol use early in pregnancy. So in response to your question earlier, is it ever too late? No, it's never too late, because there are lots of other things that alcohol will do during the pregnancy, but we've got to get the information out there. You can't drink. Well, to put it another way, I want to see big billboards put up all over that say, if you're having sex, don't drink, because that's really the message, because pregnancies so often are unintended. And if you're drinking and you get past 16 to 22 days and don't realize it, most people don't know they're pregnant at 16 to 22 days, you're running a real risk for your developing fetus. On your right is this is a little girl. She's 5 years old in this. Her mother was a bartender, drinking very heavily through pregnancy. And you can see, besides other damage we haven't talked about today, you can see there's no corpus callosum. So those are just two examples of agenesis of the corpus callosum. What's more, what the most recent studies are showing also is if you're smoking marijuana between 16 and 22 days after conception, there's an increased rate of anencephaly, that is the baby being born missing the entire front part of his brain. Now, I do have pictures of that, but it's really, they are such disturbing pictures, I don't usually show them because these babies basically have no forebrain. So prevention. And all the states that are legalizing marijuana, are we at least giving this information to our population?
Are you ready for a question?
Sure.
So is there a correlation from early prenatal exposure to domestic violent offenders in the studies?
ask it, I don't quite understand. Say it
So
again.
is there a correlation from early prenatal exposure to domestic violence offenders in the studies?
So the question is, if they were prenatally exposed, are they more likely to be domestic violence offenders? Is that the question?
I believe so.
To clarify, what I was talking about is you were giving the example of the driving and the tailgater and being cut off, and how the left brain correlates with the right side of the brain in action and response, from the feeling to the action. And that early prenatal exposure, how it kind of breaks down that barrier. So my mind kind of went to some of, the domestic violence portion, where they have that intense feeling, but aren't able to maybe control that feeling and strike out. So I just kind of went with the domestic violence correlation. Is there a correlation between that early fetal exposure to alcohol? And is there any studies that maybe show that because of that lack of communication from the left brain to the right brain, that maybe some of these people are more apt to be like domestic violence offenders or violent offenders, I guess, in general, because they're the emotional and the action response?
Great. I mean, that is a great question. It's a great research study for you, because there is no study specifically looking at domestic violence. And you have to be careful when you do a study like that. You're having to say, okay, what is the definition of domestic violence? Is it physical? Is it emotional? So it gets very complicated. So there's no study that tells us about domestic violence. However, there are multiple studies that show that prenatal alcohol exposure makes the individual much more likely to be involved in the criminal justice system. That would be another. Kelsey, I need you to make some notes for me about topics we need to address, because I think we have 5 or 6 more webinars scheduled that we're going to be doing between now and June 30th. And so we could do one on this very issue, criminal justice system, prenatal alcohol exposure. I have been involved in several death penalty cases. There's lots more we could talk about. So I'm going to save that for a webinar. It's a great question. Domestic violence specifically, I can't answer that. We don't, but
maybe more to the impulse control.
Yeah.
Since it's in the justice system.
Yeah.
Thank you.
Yeah. So, here's a good one. So, I get these dads that come in, come on, I don't have anything to do with pregnancy. Men's use of substances at the time of conception does not play a role in determining the child's neurodevelopmental outcome. False, we think. We're very early in the studies of understanding men's contribution to the child's long-term developmental outcome. However, there are studies now that do show there are epigenetic changes that occur when a man is using, the studies have been done with alcohol and marijuana. So let's talk about epigenetics just a little bit. What is epigenetics? Epigenetics is when some type of environmental factor, non-biological factor, affects the genetics of the cells. And let me just give you an example. If a woman undergoes significant stress during pregnancy, mostly emotional stress, it can cause methylation of the developing embryonic cells. Now, what is methylation? Any of you that work in the field of trauma are familiar with the methyl group, but the methyl group is a chemical group. It's 1 carbon atom and 3 hydrogen atoms, CH3. That's called the methyl group. When a woman is pregnant, during that first 12 weeks, it's called the embryonic period. I already showed you that. The embryonic period, if she undergoes a lot of stress during that time, methyl groups can attach to the developing cells. And during that time, during that first 12 weeks, those cells are known as stem cells. What are stem cells? Stem cells are undifferentiated, meaning the embryo is forming, but none of the cells know what they're going to be. Some cells will become muscle, some cells will become bone, some cells will become skin. They don't know. And during that 12 weeks, if the woman is undergoing stress, then the methyl group attaches, the cells become methylated. And methylation of the cell, attachment of the methyl group to the embryonic cell, changes the function of the DNA in that cell, the genetic material. It doesn't change the structure of the DNA, it changes the function. And the best way to think about it is think of a light bulb on a dimmer switch, and you turn the dimmer switch down. What happens to the light from the light bulb? It dims, it becomes less. And that's exactly what epigenetics is. You get changes in the function of the DNA. One of the earliest studies of this was done in Chicago. A young man who went through medical school, went through specialty training, became a pediatrician, and then did further training, became a neonatologist. He had been taught all through medical school and all his medical training that African American women have increased rates of low birth weight babies. And the reason is because of poverty and poor access to care. So he said, okay, I'll accept that. But then as he went into practice and as he saw more and more babies being born in the nursery where he worked, he saw a number of wealthy, upper middle class African American women delivering babies, good prenatal care, but still had increased rates of low birth weight babies. So he said, there's something more than poverty and poor access to care going on. What could that be? And so he did a huge study. This was published probably about 10 years ago now in the New England Journal of Medicine. And I'm not going to go through all the statistics because it's very complicated, but here's what he showed. The reason African American women today have higher rates of low birth weight babies is because of the stress of slavery 200-300 years ago. And so the slavery, the stress, the emotional stress of slavery caused epigenetic changes that are then passed on through the generations. Now, it's very difficult to do these kinds of studies because you have to be able to follow children and families multiple generations. So we do turn to animal studies. So let me just give you, this study was done by a friend of mine down in San Antonio, Texas. She took some male rats, okay? And she put them in a head hood. Now, what a head hood is, it's a plastic hood. We used to use it, 30, 40 years ago. If a baby was born prematurely and needed oxygen, it has a little hole in it that you blew oxygen into it. So she took these head hoods, put the rats in a head hood, and then got some graduate students to volunteer to blow marijuana smoke into the head hood. And so she got these rats high. And then she collected their sperm. Now, they thought they died and gone to heaven. First you get me high, then you collect my sperm. Yeah, this is a great life. But then she looked at the sperm under the microscope. And if you remember your college biology, this is a sperm. What she saw in these rats were double-headed sperm. She then let these male rats mate with some lady rats of the evening walking by. They had babies. And the babies at birth were all normal birth weight, normal litter size, everything was fine. But when they got to be teenage rats, she collected the male rat sperm. The offspring also had double-headed sperm, though they were never exposed to the marijuana themselves. It was only through their fathers. These studies are now being done in human men and finding, in fact, that marijuana does cause changes in sperm morphology. Those are called epigenetic changes. And you get all these different kinds of things. Here's the double-headed right here. And what are so we know that the genetic material has been disturbed, but what are the effects of that? We won't know for generations. So from a public health perspective, we're legalizing marijuana. We've legalized alcohol, but have we educated the public about the potential epigenetic effects of using these substances and the implications long term? Now, the good news is men make new sperm every 140 days or so. And so they're going to have fresh sperm unaffected by the substances to contribute. And then just one last thing, and we've had issues about COVID-19 coming into our various websites, but let me just make a general statement. Anything you've heard about the effects of the COVID vaccine on pregnancy outcome is false. There have been studies, there is no evidence there's any effect of the COVID-19 vaccine on pregnancy outcome. I know that's kind of off topic, but it's out there, it's all over social media, and you need to be able to respond if women bring up that issue. So I hope I've raised lots of questions for you. You've had great questions coming in. So let's take a moment here. You can go to our website, find lots more information, and of course, the Healthy Beginnings website. And Kelsey will put the link for the Healthy Beginnings website in the chat box for you. But let's open it up now. If you have questions, are there any, well, let's start with the chat box. Kelsey, are there any questions in the chat box?
Yes. Is this the change in DNA that makes an offspring more susceptible to addiction 4 to 8 times when they have parents in addiction, especially during use in the first 12 weeks of formation?
Great question. And the answer is, we don't know. We know there is a genetic component, so it's in the DNA. There is a genetic component to addiction that's been clearly shown with alcoholism, probably with the other drugs as well. Is it an epigenetic effect or is it a direct DNA effect? I have no idea, but it's something that scientists are studying.
Next question. Are there any studies done about epigenetics for other races, ethnic groups like Native Americans?
Oh, wow. That's a great one. Huh. The study that we work with quite a few Native American populations. And right now, for the last 2 years, I've been doing a lot of the kind of work we're doing with you. I've been doing it with a tribal nation in South Dakota. We're addressing substance abuse issues, but the trauma, the long-term trauma, because this was one of the populations where children were taken out of their families and put in white homes in the general population to try to, to ablate the native culture. The trauma has just been terrible. There have been no studies of epigenetics that I know of in Native American populations. there certainly needs to be. The other population, we work with the state of Alaska. So we work with a lot of Alaska natives. That's another population that has suffered horrendous trauma. No one has really looked much further at it right now, but it needs to be done. Somebody mentioned domestic violence earlier. Does domestic violence cause, just in general, not during pregnancy necessarily, does it cause epigenetic changes? We know trauma in general will cause, in an adult, will cause epigenetic changes. But does that vary by race, ethnicity, et cetera? See, this is a whole new field. I would say these studies have only, at the most, been in place for about 10 years now. So there's a whole new area that needs to be looked at.
Next question. In the 60s, they told us LSD changes chromosomes. Any updates with that research?
Well, I'm not so sure I'd even call it research. There was a lot of anecdotal information about LSD. I'm not sure anybody ever showed it does cause chromosomal changes. Whoever asked that question, of course, is giving their age away. They said back in the 60s, they told us. I remember those days too, but yeah, I don't think we can say much about LSD that's founded in scientific principle.
And that was it for the chat box. I want to open up as an open forum if anybody would like to comment or question. For Dr. John just said, are you aware of educational materials, flyers, etc., that are geared for educating the general population about genetic, epigenetic changes to sperm, other harmful effects of THC?
We have a number of brochures on our website. None of them address epigenetics per se, but that's a great idea. And actually, if Kelsey would make a note, we do, if you go to the Healthy Beginnings website, I don't know if all of you are aware, but through Healthy Beginnings in Sacramento, we're on social media, Instagram, Facebook, TikTok, and our latest data, we have thousands and thousands of, it's a different part of our organization, so I can't talk about social media very intelligently, but we've had a tremendous response, thousands of visits and input and everything that you do on social media. And so we do have some information about epigenetics, especially marijuana and epigenetics, on the website. John, if you think there is a specific need for more information, you need to just get back to Kelly or Michelle, and we'll try to put something together for you. For the general public, I understand.
I've had a couple of examples of even some of the most ardent supporters of marijuana when you start talking about changing the actual sperm shapes and that kind of thing. That's one of those things that sometimes can even get through there. So I just thought that would be, if it was geared in the language and pictures and things like that, that would be geared for the general population, that might be able to have some effect where other methods may not. So just
I'll tell you what, John, could you, I'm sure Kelsey knows you, is that right? Yeah. Kelsey, could you see if you can find a time for John and me to talk further?
Of course.
John, I'd love to get your ideas and let's see if we can put something together.
It'd be my honor.
Great. This is what we want. We want, all of you know your community better than I do. And so if you've got ideas of what's needed, I know many of you work directly with Kelsey, with pregnant women. If you see things that are needed, if there are gaps out there, let us know. We just signed on. I think I can talk about it, but we just signed on with you for another 6 months at least. And so
more training to come.
We're ready. Yeah. And materials, that's what we're here for.
Open forum. Does anyone have any additional questions or concerns for Dr. Chasnoff?
Comments. This is the first time I've ever done a webinar based on the myths and misinformation out there. Was it helpful? Did you learn something new? How can we improve it? The good, the bad, the ugly?
Yeah. John, I see your hand up.
I personally think this was one of the more powerful ones, even though there was great facts on the ones before, but specifically addressing the myths seems to that it has the ability to get people's attention and get information to folks that can actually make a difference out there that we can present to other clients. That's why I was talking about the flyers and everything to back it up. Yeah. So I thought this was great. I think this would also be appropriate even for a larger audience, a broader audience, I think, as well.
Yeah. I liked this one too. And I'd like to do at least one more because I have all sorts of other myths listed that we didn't get to today. And if some of you have ideas for other myths, if you hear things, Kelsey is my main person to be in contact with. So she'll transmit your ideas to me and we'll try to address them.
And then I do see hands raised. Crystal, you can take yourself off mute.
Thank you. Yeah, I do appreciate this. This was great. I think, like John was saying, getting the information, especially around marijuana, there isn't a lot of information about those impacts and those effects. And then definitely being able to get it out to our homeless community because they don't have the same access to the materials that we do. They don't have the phones to go online and, educate themselves and research. So definitely look forward to hopefully seeing some flyers out soon.
One of the things, if you're working directly with pregnant and parenting women or parenting men, we do have a video. It's a 3-minute video on marijuana use in pregnancy. It's available in English and in Spanish. And you can download it to your cell phone or your iPad, and you can show it. If somebody's, ask you about marijuana, all the kinds of things and lots more about marijuana use in pregnancy. It's an animated film. It's a lot of fun. Our clients and patients get a lot out of it, and it's available to you. So I think you can download it through the website, or if not, let me know and we'll make sure that it's available to you, but you can put it right on your phone and it's right there for you.
All righty. Well, if you guys don't have any other questions or concerns, we can conclude. Thank you again, Dr. Chasnoff, and thank you again, everybody, for participating.
Yeah, it's terrific. Thanks for all your good questions. I appreciate it.